Okay, so we will discuss about the Cushing syndrome. Okay, Cushing syndrome is the name given to the clinical symptoms and signs, including the chronic glucocorticoid excess. Okay, when the glucocorticoid will increase in chronic level, it's called the Cushing syndrome. Cushing disease refers to the specific condition to excess corticosteroids uh, as a result of an ACTH secretion secreting pituitary adenomas, leading to bilateral adrenal hyperplasia. And so cortical Cushing syndrome is the uh, sign which include the chronic glucocorticoid excess, and the Cushing's disease is refers to a specific condition of the excess of corticosteroids as a result of ACTH secreting pituitary adenoma, leading to bilateral adrenal hyperplasia. Okay, there is the bilateral adrenal hyperplasia. Okay, bilateral adrenal hyperplasia and excess cortisol secretion. Okay, it's called the Cushing's disease. Okay, so Cushing syndrome is different thing, and the Cushing disease is the different thing. In the Cushing's disease, there is the ACTH secreting pituitary adenoma, which increase the uh, which leads to bilateral adrenal hyperplasia and excess cortisol secretion. Okay, Cushing's disease is also associated with the hyperpigmentation due to the melanocyte stimulating ACTH action of the ACTH. Okay, Cushing's disease also associated with the hyperpigmentation due to melanocyte stimulating action of the ACTH. Now, causes of the Cushing syndrome. So, uh, this may occur due to excess secretion of the ACTH. Excess, it's called the Cushing's disease. Okay, then excess secretion of the cortisol and the exogenous steroids. Okay, so Cushing's syndrome is due to first excess secretion of the ACTH. So ACTH secreting pituitary adenoma called Cushing's disease. Then ectopic ACTH, or it is the lung cancer. Then excess secretion of cortisol, adrenal adenoma or carcinoma. Okay, this is the ectopic ACTH or lung cancer. That is the lung cancer. Then excess secretion of the cortisol, due to adrenal adenoma or the carcinoma, adrenal adenoma or the carcinoma. Okay, so directly from the adrenal cortex, the cortisol is secreting more, or exogenous steroids. Due to exogenous steroids, the adrenal cortex zona fasciculata will increase the secretion of the cortisol. What are the clinical features of the Cushing syndrome? So, uh, plethoric moon face. Okay, the face of the patient will be of like moon face. Then central obesity. The central obesity is also there. Okay, then impaired glucose tolerance or diabetes. Okay, patient will be having diabetes. Okay, then hypertension. Okay, hypertension will be there. Then menstrual irregularities, erectile dysfunction. Okay, if the patient will be girl, then the menstrual irregularities, and the if it's a boy, then the erectile dysfunction will be seen. Then osteoporosis and kyphosis. Osteoporosis will be seen. Okay, osteoporosis will be seen, and the kyphosis, and the purple stria, and the tendency to bruise easily. Okay, purple stria will be seen, and the tendency to bruise easily. Proximal myopathy, then hirsutism and frontal alopecia. Hirsutism and the frontal alopecia. Then ankle alopecia will be on the front side. Okay, here it's alopecia, then ankle edema, then the interscapular fat pad. Okay, interscapular, here is the scapula on the back side, so interscapular fat pad will be there. Okay, interscapular fat pad will be there, then acne. Okay, a patient will have acne, then musculoskeletal aches and pain, musculoskeletal pain will be there, then depression, poor wound healing, and the polycythemia. Okay, the cells in the blood will be on higher side, then the poor wound healing, then depression, musculoskeletal pain, acne, interscapular fat pad, ankle edema. Okay, ankle edema, then uh, okay, ankle will be edematous, then interscapular fat pad, that's done, then hirsutism, and frontal alopecia, then if the patient is girl, then hirsutism, man-like appearance will be there, then proximal myopathy, then purple striae and tendency to bruise easily, then osteoporosis, kyphosis, menstrual irregularities, the erectile dysfunction, then the hypertension, diabetes, central obesity. Okay, central obesity and the moon face. These are the characteristics of the Cushing syndrome. And lastly, the management. So if adrenal tumor is found, adrenalectomy is treatment of choice. Adrenalectomy is the treatment of choice in the ectopic ACTH. Okay, if the adrenal tumor will be there, then ectopic ACTH, appropriate treatment of the underlying malignancy, and medical control of the cortisol level are needed. Okay, underlying malignancy treatment and the cortisol level will be medically treated. Then in Cushing's disease, uh, transsphenoidal removal of the pituitary adenoma is needed. Transsphenoidal removal of the pituitary adenoma is needed. Then medical treatment like metirapons, which blocks the cortisol production. Okay, medical management like metirapons will block, which block the cortisol will produce, can be used preoperatively. Okay, it will be used preoperatively if symptoms are severe, or there is uncontrolled hypokalemia, diabetes, and hypertension. Okay, so if there is a severe uncontrolled hypokalemia, diabetes, and hypertension, then we should give the metirapon, which block the cortisol production. Okay, before the operation of the transsphenoidal removal of the pituitary adenoma. Thank you.